SF Commons is San Francisco's community access TV station where anyone can make a show to bring you a slice of what people and organizations are doing in our city. With the COVID-19 pandemic having stretched months now, the UN earlier last week warned of spikes in mental illness, especially among those who are most vulnerable. And Access Institute has been providing a mental health safety net to the most vulnerable people in San Francisco, low income, insured, and people who otherwise can't access psychological services for over 16 years now. And Bart Magee is the founder and executive director of Access Institute, and he's here to talk to me just in time for Mental Health Month. Thanks for joining me, Bart. And so.
Thank you.
Your services normally are offering low-income people who can't access psychological services, those services in your Hayes Valley Clinic, right inside schools, and also within the senior center in Bayview Hunters Point. And so can you start by telling us a little bit about how you've seen people's needs changed, how their kind of mental health states have changed with the pandemic, and how Access Institute has adapted your services accordingly?
Yes, absolutely. So yeah, I mean, well, the first thing to say is that we haven't changed in terms of providing services. So we are providing, in fact, more services than we ever have. And we're doing that somewhat differently in many cases because of the shelter-in-place order. We're doing a lot of our services online. But we are actually providing more because people are really experiencing more stress and more anxiety, and the shelter-in-place is causing people to feel more isolated. So for example, where we were in the schools, as you said, since the schools are closed, the children that we're seeing and the families that we're seeing are really the most vulnerable kids in our city, from very, very challenging backgrounds. So we are now providing more support to the families and seeing those children in online sessions like this, and doing our best to provide them services in the home, which is very different than providing services in the school. Similar for the seniors in Bayview Hunters Point, they're actually at home now and very isolated, and we've been working really hard with the nursing staff there to make sure that our therapists are connected with them. And then with our services at the clinic, we're providing extra sessions for people. As you said, everybody's very low income, and so our services are all on a sliding scale. But for many people who've lost jobs, and that's a large portion of the people that we serve, we've reduced those fees or even eliminated fees. We're also providing extra case management services for people so that they can apply for health insurance and get assistance with getting grants and finding jobs. And in addition, we've added a number of support groups, online support groups, specifically around supporting people during this crisis.
We're hearing a lot that people are affected not just by getting sick or a contagious virus, but the fallout from sheltering, from losing jobs economically, from people having to be with their families or not being able to be with their families, depending on who they are. So I guess it would be nice, could you give us, as a community mental health expert yourself, what are people going through and what sort of impact or harm have these past months caused on people's mental health?
Well, as you said, this is affecting everybody. I mean, if you've looked at any polling, there's a large majority of people are reporting that the effects of the pandemic and the shelter in place is affecting their mental health. So it's a very broad impact. But let me just say, for people that are the most vulnerable, who are the people we serve, the impacts, I think, have to do with people's experience of having early childhood trauma, for example. A large number of the people who we serve have experienced trauma. And, the two main factors here which impact that are the level of anxiety around the coronavirus, so the fear of infection, and also just the kind of general anxiety that this has created in our society. The fact that we don't know, how we're getting out of this. I mean, there's some sense now, but, there's a lack of clarity. So that's one piece. And then the isolation. So people need contact with others. I mean, we are social creatures. So for people who have experienced trauma, those impacts are much greater, because if you experience trauma, intrusive trauma, like you've had an experience of being abused or neglected, those impacts are greater because you grow up already feeling like the world isn't safe. And the treatments we provide help people establish more of a feeling of internal and external safety in the world. So right now, the world does not feel safe for people. So if you have already that kind of experience, it's much more difficult. In addition, one of the ways that people can feel safe is through relationships. You know, feeling connected, feeling like someone understands you, feeling like they're there to support you, provides that. And it's much more difficult now because we have the forced isolation. So this is all the more reason why mental health services are more important today than ever. Because your relationship with your therapist not only helps you increase your sense of resilience or feeling safe in the world, but also gives you that feeling of connection.
Especially for people who are going to be more isolated because there may be seniors in a home or children with family troubles at home. And that just makes me wonder, also again, like as a community mental health expert, why is a community's mental health and positive mental health important to a city's health? Why are your services so important in San Francisco?
Well, I kind of touched on it, really, we're all in this together. A city thrives because of its community. And when I'm healthier, it's going to impact the whole city and community. In fact, that's one of the bright spots I kind of see potentially coming out of this. I do, as you said, I mean, we're going to probably have a lot of a mental illness to deal with because of the pandemic. But, one of the things I'm hopeful about, with the pandemic is that what we've seen is the way in which behavior has changed so rapidly. I mean, one of the things that's really powerful, and especially in the Bay Area, we were one of the first communities in the country to move towards social distancing, shelter in place, and really thinking about managing this virus. And that took a lot of behavioral change. People had to really move together. Well, the same kinds of changes are needed for a healthier community in general. And I'm hopeful that this kind of what we've been able to observe, and we can make similar kinds of behavior changes. So think about a community where people really are volunteering and really getting involved and supporting each other. As I said, that's a key mental health component, right? Is a community where people are really feeling connected and really feeling in it together. And all the other things that are involved in that. Just an empathic connection to others in the world is a kind of foundation. And hopefully our San Francisco community can come out of this with some more of that.
Definitely. One thing that I've noticed from doing this show and interviewing a handful of nonprofits in the past week, it's been so uplifting, so inspiring, so heartwarming that people have changed behavior quickly and people have jumped in to help their neighbors. And we are wired for community and to help each other. It's biological. And so that's also something I've heard a lot of organizations say is that what do we hope for to see after the shelter orders are lifted, the emergency is over? Some of the things that people say they hope to hear are that this continues, that people continue to notice and care about the most vulnerable in the community. And what are you hoping in terms of, mental health from all of us as the public continues past the pandemic? What are you hoping to see?
Yeah, well, beyond that, beyond the sense of a community coming together and being more connected, I also think that this pandemic has highlighted the way in which certain people are more impacted by things like this. In other words, the kind of inequality in our society. And I'm hopeful that when we come out of this, there'll be more of an effort to support people who really need resources more. So be that, economic resources, educational resources, social resources, and things like mental health that will really be thinking more about providing these kinds of services for the whole community. I mean, we are one organization doing our part, but, we need a whole, we need a much bigger effort to make a real change.
Yeah, it's hugely are seeing the holes in the system, the gaps in what the government, the cities provide. And it's wonderful that there are these safety nets and nonprofits like you who are really there for people who need it and for the most vulnerable. And it's the pandemic crisis has really put such a spotlight on where improvements are needed, and hopefully that carries forward. I was wondering if you have any stories or anything to share about, the impact that Access Institute's services have had during the pandemic, whether on any seniors you work with, or just like where would they be without you, and what have they gained from your therapists and caseworkers?
Yeah, I mean, I think a good example is just the like you said, like seniors who are so isolated at this point. So the seniors we have been serving previously had been we've been serving them as part of a community in an adult day health center. Well, now they're all isolated in their homes. Many of them with family members who are overwhelmed and really don't have the time to care for them. And also, many of the seniors don't really understand what's going on because of, various levels of dementia or Alzheimer's. So, the connection to the therapist is vital as someone who's actually there to really follow them and be able to really connect with and understand how these changes have impacted them. I mean, think about it. You had a level of support by going every day to an adult day health center where you had nurses, where you had people, you had your friends there around you at the table eating, and then all of a sudden that's gone. And you're isolated in your room by yourself. So the connection with the therapist is like, that's a reminder that there's something there, that somebody's there with you, supporting you, and that's not going to go away.
Yeah, and that's all some people might have, day by day during the sheltering. It sounds like that relationship with the therapist is all that they have. So it does make a big difference. So for people who might be listening or have heard of Access Institute or who care, we're just seeing so much how it's coming out that people care about our neighbors and our community and love the work that Access Institute is doing. How can people help or get involved or support the work that you're doing?
Well, people can get involved. I would say the main first thing to do is just go to our website, and you can go there and learn more about us. And there is a page that tells you about how you can get involved, but there's ways to volunteer, there's ways to join our efforts, and also to contribute financial support, because we are a nonprofit, and so we do depend on the financial support of our community.
Thank you so much for all the work you're doing. Thank you for taking the time to talk to us and tell us about the services Access Institute is offering to vulnerable people. I know you have high percentages of those that you serve are low income, are uninsured, underinsured, and it's making a huge difference, as you talked about. So thank you so much, Bart, and everybody at Access Institute.
Thank you.
I'm joined remotely via Zoom by Sammie Rayner, the Chief Program Officer of Community Forward SF. Sammie, thanks for being here this afternoon.
Thank you, George.
I would love to start with having you kind of walk the audience through what your model is of what you guys call the holistic full person services.
Of course, yeah, at Community Forward, we're a network of programs that serve the homeless service community, focused really on the most vulnerable people in the homeless population. So whether you're a trans woman and looking for a safe place to just rest for a little while, we have a Woman's Place drop-in center, all the way through to a medical shelter facility. If you're imagine recovering from cancer or chemo and being in a homeless shelter, you're going to need more services and care. So We provide medical services in addition to just a shelter through a partnership with Department of Public Health, all the way to housing, and run 2 different housing programs in the Tenderloin. And the common thread, the holistic care that you mentioned, is really adding in a mental health, behavioral health, and medical health services on top of just a room and a place to stay, and recognize that you really have to meet individuals where they're at and provide services that support the very diverse range of needs of our community.
And then you guys also work with, you have a sobering center as well, which kind of gets back to the whole idea of housing first, as being a city policy, but then you also work with seniors. Can you share a little bit about that? Of
course. We're a 41-year-old agency, so have been around for a while, and actually one of the very, very first services that the agency provided was sobering and driving around vans, helping folks on the street who needed a safe place to sober up. And so we do have a sobering center where people can come and just have a safe place to rest, sleep, be under nurses' supervision while they're getting better, and then at the end of that, when they are able to kind of come out of and sober up, they're able to talk to a nurse, talk to a case manager, and think about other steps that they can take for their life. And we also, I think, didn't necessarily start focused on seniors, but the whole homeless population is aging. That's something that not a lot of people know. So majority of the folks that we serve are over 55 across all of our different programs.
And then the other thing I wanted to kind of get to was, how has COVID-19 really impacted your entire network of services?
It's hit each of our operations slightly differently. For particularly, I think one of the heaviest and hardest impacted places is our drop-in center. Our Women's Place Drop-In Center serves about 3,000 women a year. And so as you can imagine, that's not an operation that can really run safely, having lots of women in one space, doing laundry, taking showers. And so it was really, extremely difficult when shelter in place set in, and I don't know if you know, but city shelters weren't taking new reservations. And so we're having lines of women coming like, hey, what am I supposed to do? And there was a really hard several weeks when we were actually just sheltering in place in our drop-in center. So women in plastic chairs for weeks until the city was able to open up hotels. And that has been a really exciting kind of lift of pressure off of us. Not just the drop-in center, but our shelters were also really too full to properly socially distance. So now that hotels are open to our clients, we've moved all of our folks who are over 60 out of the shelters and programs and into hotels. And our staff are actually moved with them and continuing to provide care and services in hotels. So that's been the biggest transition, is just figuring out how to run these programs in hotels and keep people safe.
And so what are some of the other needs that you're seeing?
We're I think there's a lot of needs across the community. I think one of the biggest is just to continue this hotel push. There are not nearly enough people in safe spaces yet. We have been able to move a lot of our folks, but there's so many people who are still on the street who would normally be knocking on the door of a Women's Place Drop-In Center and getting services, who aren't being served right now. So continuing to do that is important. continuing to donate and provide personal protective equipment is really important. And I think just to honor and recognize the staff, not only of our agency, but of organizations across the community. I think now is a time when the public is recognizing that homeless services are public health services. Housing is healthcare, right? You can't be safe from a pandemic if you don't have somewhere to stay. So continuing to advocate to your supervisors, letting people know this is really the most important way to keep people safe. We all keep hearing over and over is to socially distance, right? And protect yourself. So advocating for everyone to be able to do that is really important.
And Sammie, how can people who are viewing this really help Community Forward SF? What do you guys need? You know, volunteers. I know you've launched a funding campaign, just like everybody else out there has been impacted. What can folks do to help?
We do have a fundraising campaign for who we call our frontline heroes. Community Forward has over 80 staff members who are on the ground daily checking people's temperature at the hotel or at the shelter to make sure that we're tracking for who might get COVID and keep people safe. So those are really the city's heroes. And so we're doing a fundraising campaign to provide hazard pay to recognize the incredible risk these staff are taking, who have their own families, their own communities that they also want to protect at home. And so needing to recognize that risk they're taking. And that campaign is on our website, communityforwardsf.org, and also on the Hand Up platform.
And what do you guys see? So as we eventually lift the shelter orders, what are some of the things that you and your team would like to see happen? As the shelter in place is actually lifted.
This pandemic has, I think, like I already said, has shown us that housing is healthcare, that we really need to recognize homelessness as a public health crisis even before COVID. And this change that has come about of placing people in hotels, I hope is one that will stick, and will recognize that the old shelter model is flawed. It's really hard to provide for individual needs in really kind of overpopulated shelters. I mean, I don't know about you, but when you're not feeling well, or when you're kind of at a low point in your life, if you're crowded with a bunch of other people and aren't necessarily getting individual care, it can be hard to advocate for yourself and your needs. And so that's the wave of change that we're hoping will continue after this is the broader recognition that it's not just about these individual folks' safety, it's our entire community's health that's at risk by not providing housing.
And then I think the other final question would just be, here we have a pandemic and kind of a meltdown in so many ways. What would you say are some of the positive things that could come out of the crises to support not only our unhoused community members, but society at large?
I'd love for us to buy a building, for the city to buy up buildings. I think that that could be there's going to be empty offices, empty spaces. I think that now would be an amazing time to really truly double down on the housing first model, and to I guess continue to keep people in either the hotels or some other kind of housing model. And then I guess the other piece is just, I hope that people will see our staff, see the public health workers who are, like, even before this pandemic, to me, they were heroes. They're out there every day providing and caring for the people who often are left invisible. And so I would love for, minimum wage increases or, anything that can help provide more of a living wage for people who are on the front lines, so that their whole focus can just be on those clients and their needs, rather than how am I going to work 2 to 3 jobs to be able to do this work that I'm so passionate about.
Thank you, Sammie, for sharing your team's work today, and we'll make sure that we have all the contact information on the website and social media of how people can follow up with you guys and get engaged. And is there anything else that I haven't asked you that you would love to talk about today?
Yeah, no, I think those are the key things. Keep reaching out to your neighbors and checking in, seeing where people can use help, but also look at the neighborhoods outside of maybe your immediate surrounding. And yeah.
Sammie, please stay safe out there and healthy, and give my best to Kara and to the whole staff. Thank you.
Thank you.